As soon as we are done with our gowning techniques, we'll go ahead with gloving. In this, we'll first wear the glove in our dominant hand without touching the sterile region. And next we'll wear in our other hand and pull the glove down and secure its grip in our wrist. After securing the grip in this hand, we'll then pull the remaining part of the first glove and adjust it properly. As soon as we are done, we'll intervene the hands between and lock the glove, and then we'll start with our operation. Thank you.